Hi, let's briefly talk about peptic ulcer disease. Now, peptic ulcer disease in its simplest form can be defined as when painful sores form in the lining of your stomach or the first part of your small intestine, known as the duodenum. Now, peptic ulcer disease can be classified according to the location of the ulcer, which can either be gastric ulcer or duodenal ulcer. Having talked about the anatomical classification of peptic ulcer disease, let's further classify gastric ulcer. So gastric ulcer can also be classified class 1, 2, 3, and 4. Class 1, this is an ulcer that is sitting in the lesser curvature. And then class 2 is an ulcer that is sitting in the lesser curvature as well as the duodenum. Class 3 is an ulcer that is sitting in the fundus. And then class 4 is an ulcer that is sitting in the cardia of the stomach. The risk factors for peptic ulcer disease include prolonged non-steroid anti-inflammatory drugs use, alcohol, smoking, gastrinomas. You can have inflammatory bowel disease such as Crohn's disease. You can also include malignancy. What are some of the investigations that we do when a patient presents with a suspected peptic ulcer disease? You have your lab investigations as well as your radiology. Under radiology, this is where you do your endoscopy. Under lab investigations, this is where you do your H. pylori test. You also do your US test and serology for H. pylori. Now, under endoscope, there's what is known as forest classification of peptic ulcer, based on what you see when you do endoscopy. Now, there's class 1, class 2, class 3, and then class 1 has two components, and class 2 has two components. Class 1, you can define it as active bleeding. There is class 1A, which is active bleeding, class 1B, which is oozing bleeding. And then class 2 is just evidence of bleeding, which you can classify as class 2A, there is no bleeding, class 2B, there's a clot in the vessel in that ulcer. And then class 3 is a clean ulcer. Moving on to the complications. Remember, the complications are also the indications for surgery. The complications, number 1, you may have bleeding. There can be perforation. There can be gastric outlet obstruction. There can also be intractability. There can also be suspicion of malignancy. And then the management now. Basically, peptic ulcer disease is managed medically by giving the triple therapy. So now the triple therapy involves the giving of one proton pump inhibitor as well as 2 antibiotics.